Hello, we are going to know about invisible aligners or clear aligners today. So let's see. So, to whom we can advise invisible aligners or who can use invisible aligner? So, the one who have spacing in between their upper and lower teeth, or if you feel a crowding in your teeth, if you feel any food lodgement in your teeth, that means you have a spacing, so you can go for invisible aligners. Any case which is mild to moderate can go for invisible aligners. So we are going to see certain cases about it. So first is what material we use for invisible aligners. So the material is a bioplastic which is compatible in your mouth, compatible to your oral environment. It is non-allergic material. It cannot cause any allergy to anyone. Then the color is obviously invisible, which is transparent color. Then the aligners are generally customized for your teeth. Even your first set is not similar to your next sets, because it is customized to the every stage of your treatment. As first in the aligner treatment, we do scanning. After scanning, your video comes, and after that you can see your after aligner results, and from that result we customize your one set as how many sets orthodontist advised you, from 1 to 10 in mild cases maybe, or it is depend upon your case generally. So what we do is we order your sets, and then you have to use your sets. For using sets, you have to place attachments on your teeth. Then what are the attachments? Attachments are basically a composite material bubble like structure which is placed on your teeth, which is already customized in your sets. So we have to use that for lock mechanism. Then for how much time you have to wear your aligner set? You can use your aligner set for about 22 hours in a day. At least 22 hours. You just have to remove your sets for eating anything or for drinking anything other than normal water. So we are going to see what we can eat or what we can have using aligners, or for eating, do we have to remove aligners or not? Okay, so when you wear aligners, you just have to take water, normal to cold water. You don't have to use any warm water for rinsing or for drinking. You can drink anything, you can eat anything by removing aligners, like from small things to your meal. When you wear your aligners, you have to avoid biting hard. Then you have to avoid eating anything wearing your aligners. Then many people ask, are aligners really painful or not compared to braces, or compared to traditional method of a teeth straightening? So aligners are not painful basically. Yes, you can cause any discomfort or a slight tightness in your teeth, because your teeth are not used to any treatment or any particular type of any foreign body. So you'll feel any discomfort or any tightness in your teeth in a starting days, like for 15 days, 1 to 2 set of time. After that you'll get used to it. If you feel slight pain and it's not bearable for you, you can take any painkiller for that. So compared to braces, yes, definitely it's not painful that much. And many people ask, like braces, in some cases we have to remove our teeth, some of our teeth. So in aligner cases, do we have to remove teeth? So it's depend actually. Like braces, we don't have to remove many teeth because we can give aligners in only mild to moderate cases. For severe cases, we generally advise braces. Why? Because braces can apply more force on your teeth compared to aligners. So in aligner, normal spacing cases can be covered easily. So the last thing to discuss is which one is better, braces or aligners. So in that case, we can say that braces in severe cases, braces can be used, or in mild cases, in moderate cases, aligners can be used. Even in some cases, we can use combination treatment, like we can do treatment first of braces, and we can covered maximum changes with that, and after that we can use aligners for the mild changes after that, which is stage 2. So in that case, we can avoid long treatment period of braces by dividing into two parts. So that's it for today.